ACS drugs. Oxygen. Classification: elemental gas. Mechanism of action: facilitates cellular energy metabolism. Indication: chest pain, hypoxia, respiratory distress. Contraindication: known paraquat poisoning. Dose: adult, 4 liters per minute via nasal cannula. Titrate to maintain SpO2 to greater than 94%. Special consideration: also available over the counter. Aspirin. Classification: antiplatelet, non-narcotic, analgesic. Mechanism of action: inhibits the aggression of platelets. Indications: chest pain. Adverse effects: anaphylaxis, angioedema, bronchospasms, stomach bleeding, or irritation. Contraindications: children, known sensitivity, hemorrhagic stroke, bleeding disorders, relative contraindications in ulcers and asthma. Dose: adult, 324 milligrams by mouth, chewed and swallowed. Nitroglycerin, also known as nitrolingual, nitroquick, and nitrostat. Classification: anti-anginal nitrate. Mechanism of action: relaxes vascular smooth muscle, promoting dilation. Indications: ischemic chest pain. Adverse side effects: headache, hypertension, bradycardia. Contraindication: hypotension, increase intracranial pressure, or brain bleed. ED prescriptions. Dosage: adult, 0.4 milligrams sublingual, or spray if systolic blood pressure is above 100 milligrams per mercury. Special consideration: may administer prior to IV if systolic blood pressure is above 120 milligrams per mercury. Use with caution if in suspected right ventricular infarctions. Morphine sulfate. Classification: opiate agonist. Mechanism of action: binds with opiate receptors, may cause histamine release. Indication: ischemic chest pain. Adverse effects: respiratory depression, hypotension, nausea, vomiting. Contraindications: hypotension, respiratory depression, shock. Dosage: adult, 2 to 5 milligrams, may repeat every 5 minutes. Max dose of 20 milligrams. Peds, 0.05 milligrams per kilogram, may repeat every 5 minutes. Max dose is 0.2 milligrams per kilogram. Special considerations: IV admin should be given slowly. IM limited to 1 admin. Fentanyl citrate, also known as Sublimize. Classification: narcotic, analgesic. Mechanism of action: binds to opiate receptors. Indication: ischemic chest pain. Adverse effects: respiratory depression, apnea, hypotension. Contraindication: known sensitivity, traumatic brain injury, respiratory depression. Dose: adult, 1 microgram per kilogram, may repeat every 5 minutes until max of 3 micrograms per kilogram. Special consideration: pregnancy class B. Metoprolol, also known as Lopressor, Toprol XL. Classification: beta-adrenergic antagonist, anti-agonal, antihypertensive. Mechanism of action: inhibits the strength of the heart's contraction, slows tachycardia, reduces myocardial oxygen demand. Indications: ACS, hypertension, tachycardia, dysrhythmias, thyrotoxicosis. Atenolol, also known as Tenramin. Classification: beta-adrenergic agonist, anti-agonal, antihypertensive. Mechanism of action: inhibits the strength of the heart's contraction, slows tachycardia, reduces myocardial oxygen demand, inhibits dilation of bronchial smooth muscles. Indications: ACS, hypertension, tachycardia, dysrhythmias. Esmolol, also known as Brevibloc. Classification: beta-adrenergic agonist, anti-agonal, antihypertensive, class 2 antiarrhythmic. Mechanism of action: inhibits the strength of the heart's contraction, slows tachycardia, reduces myocardial oxygen demand. Indications: ACS, hypertension, tachycardia, dysrhythmias, thyrotoxicosis. Propranolol, also known as Indrol. Classification: beta-adrenergic antagonist, anti-agonal, antihypertensive, antiarrhythmic, class 2. Mechanism of action: inhibits the strength of the heart's contraction, slows tachycardia, reduces myocardial oxygen demand. Indications: ACS, hypertension, narrow complex, tachycardia, dysrhythmias. Clopidogrel, also known as Plavix. Mechanism of action: blocks platelet aggregation. Indications: ACS, chronic coronary and vascular disease, ischemic stroke. Heparin, also known as Unfractionated heparin, low molecular weight heparin. Classification, anticoagulant. Mechanism of action, acts as an antianthropic 3 to reduce the ability for blood to clot. Indications, ACS, pulmonary embolism, deep vein thrombus. Abciximab, also known as renal pro. Classification, GP2B3A inhibitor. Mechanism of action, prevents the aggregation of platelets. Indication, STEMI and non-STEMI patients. Epifibatide, also known as Integragen. Classification, GP2B3A inhibitor. Prevents the aggregation of platelets. Indication, STEMI and non-STEMI patients. Tirofiban, also known as Aggrastat. Classification, GP2B3A inhibitor. Mechanism of action, prevents the aggregation of platelets. Indication, STEMI and non-STEMI patients.